Hey everyone, and welcome back to Tech Talk Highlights. I'm your host, Kiara. Today we're diving into something that's been quietly changing the way we visit the doctor, especially in the past few years, and that's telemedicine. Now, you might have already used it without realizing. Maybe you had a quick video chat with a doctor for a sore throat, or maybe your therapist switched to Zoom sessions. That's telemedicine. In simple terms, telemedicine means getting medical care remotely, using phones, video calls, apps, or even wearable devices. No long drives, no waiting rooms, just access to care when and where you need it. In this episode, I'll walk you through what telemedicine is, how it works, the tools behind it, the pros and cons, and what the future might look like. Let's get into it. So, why this topic? Well, I chose telemedicine because it's not just a tech trend. It's real life. It affects patients, doctors, families, everyone. And it's growing fast. During COVID-19, telemedicine went from being a maybe someday option to a must-have. It helped people get care without leaving home. But now, even after the pandemic, telemedicine is here to stay. I want to explore how it works, why it matters, and why we need to think about it as it becomes a more common option. And don't worry, I'll keep it easy to follow, just like a friendly chat. Let's start with the basics. Telemedicine is when doctors and other health workers give care remotely without being in the same room as the patient. It happens through video calls, phone calls, messaging apps, or even through special devices that track your health and send updates to your doctor. So, instead of driving to the clinic, waiting in a line, and sitting in a cold exam room, you could just open your phone or laptop and speak with your doctor from your couch. Here's a quick example. A mom with a sick child might video call a pediatrician, show them the rash on the screen, answer a few questions, and get a prescription, all within just 10 minutes. It's fast, safe, and convenient, especially helpful for people in rural areas or those with busy lives. So, how does all of this actually work behind the scenes? Let's talk tech. First, we have video platforms like Zoom or special apps just for healthcare. These allow private and high-quality video calls. There's also secure messaging. Patients can send symptoms or ask follow-up questions. Next, we have the wearable devices, like smartwatches that can track heart rate, sleep, and even oxygen levels. These devices can send live health data to your doctor. And the most important piece, the data privacy and the security. Because this is health information. Everything must be encrypted and protected by strict rules, like HIPAA in the US. Big hospitals use advanced systems, but even your regular smartphone is enough for basic telemedicine. Okay, now you might be thinking, is telemedicine better than going in person? Great question. Let's break it down. Telemedicine is great for basic illnesses like the flu or allergies, and mental health therapy and counseling, medical check-ins or refills, and managing long-term conditions like diabetes or high blood pressure. But there are still things that require in-person care, like physical exams, blood tests, x-rays, or MRIs, surgeries, and emergencies. So it's not about replacing doctors. It's about giving more options. Imagine telemedicine as the first step and in-person visits as the next level when needed. It also helps doctors reach more patients and reduces overcrowding in hospitals. Now, let's be honest, telemedicine isn't perfect. One big issue is access. Not everyone has a smartphone or good internet. Older adults or people in poor areas might struggle with the tech part. Also, not everything can be diagnosed through a screen. A doctor might miss something they could have caught during a physical exam. There are privacy concerns too. What if the app gets hacked? Or what if someone overhears your call at home? Plus, there are legal limits. Can a doctor in one country treat someone in another? Laws are still catching up. So, while it's useful, we still need better rules, better training, and better access to make it fair and safe for everyone. But let's look at where telemedicine is headed. There's a bright future ahead. Even though it already feels futuristic to see a doctor from your living room, this is just the beginning. The next wave of telemedicine is expected to be even more intelligent, connected, and personalized. One big development is the use of artificial intelligence, or AI. Imagine logging into your telemedicine app, typing in your symptoms, and an AI system helps sort through thousands of medical cases to give the doctor suggestions even before your call begins. This doesn't replace the doctor, but it helps them diagnose faster and more accurately. Another exciting area is remote monitoring. More people will be able to use wearable tech like smartwatches, fitness bands, or even smart patches to send live health data to your doctors. These devices can track things like heart rate, oxygen levels, or sleep, and alert healthcare providers if something unusual happens. In some hospitals, they're already using smart beds and sensors to monitor patients remotely without wires or check-ins. That's not just convenient, it saves lives. We're also seeing a growth in mental health apps that offer therapy, guided meditation, or mood tracking. These tools are making mental health care more accessible to people who may not have seen a therapist otherwise. And get this, virtual reality, as in VR, is starting to be used in therapy too. Some therapists are using VR environments to help people with PTSD, phobias, or anxiety by creating safe spaces to work through tough experiences. What about rural or undeserved communities? Telemedicine could finally bring healthcare to people in remote areas, places that may have never had regular access to doctors before. With satellites, mobile clinics, and low bandwidth solutions, care can now reach areas that were left out before. But here's the big picture. For this future to work, we need strong laws and ethical rules. Patients must feel safe sharing personal health info online. Technology should help all people, not just the wealthy or tech savvy. We'll also need to train doctors and nurses in how to use these systems and teach patients how to use them too. Health tech should be easy to use, not confusing. So yes, the future of telemedicine is bright, but we have to build it in the right way, with care, with fairness, and with people in the center. And that's a wrap on this episode of Tech Talk Highlights. Today we explored how telemedicine is changing healthcare, making it faster, more flexible, and in some cases, more personal. But we also saw that it comes with challenges, and we need to work together. Tech companies, doctors, patients, and governments to make it safe and fair for all. Thanks for tuning in. I'm Kiara, and I'll catch you next time as we explore more tech that's shaping the world around us. Stay healthy, stay curious, and as always, stay connected.